I'd like to welcome you to this Cancer Grace video, and I'm going to take you on a little journey. This is my journey from finding out that I carry a BRCA1 mutation through prevention. So I hope you enjoy, and I hope that it's helpful. My name is Gina Burris, and like I said, I am BRCA1 positive and a Previver. What does this mean? A BRCA1 carrier has a genetic change in one of the genes responsible for suppressing cancer growth. Carrying a mutation in this gene significantly increases one's chance of developing breast, ovarian, and other cancers. The word Previver. A Previver is an individual living with an inherited mutation who has never received a cancer diagnosis. Previvers include individuals who have inherited the mutation, have a strong family history of cancer, or some other factor that increases their cancer risk. My story. My story starts in January of 2020 when I purchased a 23andMe kit that included a health assessment report. My husband and I basically bought a 23andMe kit for entertainment purposes only. At the last minute, we decided that we would add the health portion. We were getting to that age where I thought maybe I would need to just watch my diet a little bit. Maybe I would be susceptible to something like diabetes. So we purchased the kit, spit in the tube, sent it off to a lab somewhere in the country, and packed our bags and went on our annual vacation. When I got the report back, I wasn't surprised to see my ancestry. It said that I am 50% mixed European and I am 50% Ashkenazi Jewish. I think it's important to note here that I knew that my father had grown up in a Jewish environment, but I didn't understand, or I didn't know that Ashkenazi Jewish is actually part of an ancestry or your genetics. So I wasn't surprised, like I said, with the health report. But when I opened the health assessment portion, it was as though it was a Broadway marquee, and I read these words: Gina, you have a greatly increased risk of developing breast and ovarian cancer. It was in that moment that my life was altered forever. I could have literally drawn a line in the sand that, because I was on vacation, I was sitting on a beach chair looking at my results, and this came up, and really it changed my life in an instant. I was a little bit familiar with what it meant to be a BRCA carrier, as I had a dear friend who had been diagnosed with breast cancer in her 40s, and she was a good friend of mine, and we were walking one day, and she had told me that she had found out that she is a BRCA carrier and that her parents would have to be tested, and that when her children became of age, they would have to be tested too. It was interesting for me. I vividly remember thinking, what would I do if I found out that I carried a mutation such as this? And so in that moment, panic just consumed me, and yeah, and everything changed. So what were my next steps? As I said, this happened in January 2020. I got my results at the very end of the month, came home from vacation, and just as I was getting ready to make all of my appointments, COVID froze the world. So now I was living in isolation, knowing that I had a BRCA mutation, and I made my first virtual appointment with my genetic counselor. It's very important to note here that 23andMe cannot be used as a diagnostic tool. And so I had to have everything confirmed with a blood test, which I did, and nobody was surprised when the result came back that I, in fact, do carry this BRCA mutation. What next? Then it was time to make a choice. I could ignore it. I could just bury my head in the sand, go about my life just like I had always done, and just let fate be my guide. I could take a medication such as tamoxifen. Tamoxifen is a hormone therapy drug which is used to treat and prevent breast cancer in women and in men. I could increase my surveillance. This means that I could have my annual mammogram followed 6 months later by a breast MRI. And I would alternate those every 6 months. And with that, that is the hope that if cancer does develop, that they're able to catch it in its earliest stages, or I could opt for preventative surgeries. Before I share my choice, I want to share some BRCA positive facts and figures with you. Did you know, on average, women in society have a 12 to 13% chance of developing breast cancer before they reach 70 or 80 years of age? BRCA1 carriers have up to a 72% chance of developing breast cancer by that age, and BRCA2 carriers have a 45 to 69% chance. Now let's talk about some ovarian cancer statistics. On average, women in society have a 1.2 chance of developing ovarian cancer before they reach 70 to 80 years of age. BRCA1 carriers have a 39 to 44% chance of developing ovarian cancer by that age, and BRCA2 carriers have an 11 to 17% chance. I think it's worth noting here that ovarian cancer is very challenging to diagnose and treat, and oftentimes by the time women are diagnosed with this, it is too late and treatment isn't effective. What about men? Men can be BRCA carriers. Men can and do get breast cancer. The average man in society has a 0.1% chance of developing breast cancer in their lifetime. A male BRCA carrier has a 7 to 8% chance of developing breast cancer in his lifetime. Being BRCA positive also increases the chance of developing these cancers too. Pancreatic, prostate, melanoma, fallopian tube, primary peritoneal, and colon. I am very grateful that I know that I carry this mutation because it allows me to have open discussions with my physicians and start scans at an earlier age than I would have normally. What is the likelihood of getting a BRCA mutation from one of my parents? If a parent carries a BRCA mutation, each of their children have a 50-50 chance of inheriting the mutation. When my son was only 24, because I know that I carry the mutation, we were able to have him tested, and it was confirmed that my only son also carries the BRCA mutation. My path to prevention. Through COVID isolation, I was convinced that my breasts and my ovaries were ticking time bombs, and at any point, they were just going to revolt against me. I was very scared and sad and anxious. And one thing that I found refuge in were good resources and support through a variety of social media outlets and groups such as Cancer Grace. After talking to all of my physicians, after speaking with my family members, after doing a lot of research and meditation and praying, in the end, I made the best choice that was for me and my family, and that was the surgical path to prevention. I was then able to put a wonderful team of healthcare professionals together, and here are just some of who were on my team. I had the genetic specialist, I had a mental health therapist. Yes, I did go to therapy, which was very, very, very helpful. I had a gynecological oncologist, a breast oncologist, a plastic surgeon, and many other PAs, NPs, nurses, techs, anesthesiologists. They were all part of them, and I'm grateful for each and every one. My personal surgical journey. I've had 6 surgeries from December 2020 through April of 2024. I started with a complete hysterectomy, including a bilateral salpingo-oophorectomy. And what that means is both of my ovaries and my fallopian tubes were taken out, as well as my uterus. I had my prophylactic double mastectomy. After that, I had a fat grafting surgery. After that, I was scheduled to do another fat grafting surgery, and I was able to finally realize that I was not happy with my original results. And so in order to get the result that I was most comfortable with, I opted to have my nipples removed, have smaller implants put in, and some scar revisions done. I went in for another fat grafting surgery, but at the last minute, we realized that I needed to have a lift and some other revisions done. So I did that. And in 2024, this past April, I just had fat grafting done. And I can finally say, after a very long journey, I am happy with my results. How I managed through the process. As I said earlier, I relied heavily on positive organizations and social media outlets and groups. I also turned to blogging. I'm a children's book author, and I wanted to use my skills to express and to explain the whole journey with the help of helping others. I really wanted a way to honor everybody who had been in my path before me and who got me to where I was. And so I used my writing skills and I created the blog River Girl Reflections. But I still felt like I wanted to do more. So I created what I call my BRCA Positive Companion book. This is a book for women to take with them as they take their journey. It is 130 pages and it's filled with educational information, motivational quotes, organizational tips, and one-of-a-kind activities. How has this all changed my life? I can honestly say it has changed everything. My body, I have multiple scars that I will live with for the rest of my life. The breast area, I have lost all feeling. And not only are the scars bad enough, but I heal with keloids. So that is just another side effect of everything. Through surgical menopause, I've dealt with mood swings, hot flashes and night sweats, forgetfulness, and my outlook. Has it changed my outlook? It sure has. I am very grateful. I am grateful to 23andMe for offering a test that I was able to use to find out that I carry this mutation. I do not have a family history of breast or ovarian cancer. So I really, really believe that had I not taken that test in 2020, by this point in my life, I would be dealing with breast cancer. I am very aware. I am more aware of my body. Knowing that I carry the BRCA mutation allows me to be aware. It allows me to have scans. It allows me to have checks and all of those things. Again, similar than before, I wouldn't have been able to do that without knowing. And I'm very mindful. I'm mindful of how I approach other people. I am mindful of what I say, and I am mindful of who is important in my life. If you want to find out if you or someone you love carries a BRCA mutation, how can you do that? First, I highly encourage you to create a family tree. This will help you identify members in your family who have or who have had cancer. Have a conversation with your physician or your physicians. If after you speak with your physicians, if they believe that maybe you are a candidate for genetic testing, then they're going to recommend that you speak to a genetic specialist. Genetic specialists are key players in all of this. They're the ones who really speak to you first. They're the one who is going to lay everything out. You know, some people want to know and some people don't want to know, and that is fine because everybody gets to pick their own journey. If you do have genetic testing, talk to your insurance company. They may cover it, especially if you are in the high risk category. Or there are other options out there. You can do direct to consumer assessments, such as the 23andMe assessment. So what's next? Advocacy. I have a passion for helping to bring BRCA positive awareness to the masses. I have the deepest respect and admiration for any human that has ever heard the words, "You have cancer." My mind and my heart are full of love for each and every one of them. And if I can help one person from having to hear those words, I will feel gratitude on an entirely different level. I think it is important to see through this journey and through working with different organizations as an advocate, I've realized my eyes have really been open. The cancer doesn't exist only here in the United States. This is a global, it is a global problem. And I think that we have a responsibility to share with people who don't have the information that we have here in our country. When we know better, we can make the choice to do better. Here's just a sample of some of the advocacy programs I've been part of. I've worked with 23andMe a couple of times. I've been interviewed to do a couple of spots during breast. I've also been asked to do some media spots for local news organizations, especially in October through Breast Cancer Awareness Month. There are three messages that I really am passionate about conveying to a wider audience. The first one is 1 in 40 of Ashkenazi Jewish descent individuals will carry a BRCA mutation. The second is save the woman. And the third is it's not a boob job. And I'm going to go into a little bit more about each of these. Individuals of Ashkenazi Jewish descent. I think it's important to point out that although it is a religion, it is also part of your genetic ancestry or your genetic makeup, or it could be. There are numerous individuals out there like me who know that they may have a descendant, a relative, a grandparent, a parent, somebody who was brought up in the Jewish faith, but that they no longer are part of that community. And I think that we just say, oh, well, I was raised Catholic, or I'm Presbyterian, I'm Lutheran, I'm all of these other things, but I know that I have a family member that was Jewish. The numbers are staggering for individuals of Ashkenazi Jewish descent. In the general population, 1 in 400 individuals will carry a BRCA mutation. But those of Ashkenazi Jewish descent, 1 in 40 will carry that mutation. 1 in 40. That is a very large amount of individuals. And like I said, it's very important to note that it's both men and women that can be carriers. So I encourage anybody who knows that they have a Jewish relative, whether you practice that religion or not, that you consider speaking to your doctor and finding out the best path for yourself. Changing the narrative. Replacing the campaign from Save the Tatas to Save the Woman. Is it a devastating thing? Yes, but it's so critically important that we change that narrative and we don't focus on our breasts or our boobs or whatever you want to call them. I think it's more important to dive down deep and really kind of have a passion for saving the women in our lives. Breasts are grand, but healthy women are grander. And let's join forces to share this message and to save lives. My third message is a double mastectomy is not a boob job. I understand that a lot of people really don't know what to say, but the reality of the situation is this. If a woman makes the choice to have a mastectomy, whether it is because she has cancer or she has a predisposition to having cancer, first of all, it is an incredibly hard thing to wrap your head around to begin with. It's important to know that this is an amputation of a body part. This is not a boob job. Breast tissue does not only exist just in the breast area. Women, everybody has breast tissue from the collarbone area to the start of the rib cage and then all the way over to under the armpit area. Nobody would ever say to somebody, oh, hey, I know you have to have your leg amputated, but look at the bright side. You're getting a free leg job. Doesn't happen. This truly is an extremely emotional and life-altering event. So please be mindful and please be careful of how you approach somebody who's making the decision. Rethinking the word prevention. As a society, we take steps to prevent a wide range of things. We wear seatbelts and have airbags in our cars to keep us safe. We take vaccines to avoid disease. We have umbrellas to stop the rain, earplugs to save our ears. We take medications and vitamins to ward off colds and all kinds of things. We use sunscreen to avoid getting sunburn. So I pose this question to you. Why should we have to wait to have the words "you have cancer" uttered to us from a healthcare provider before taking action? Perhaps the question could change from, why would you do that, to why wouldn't you do that? I believe the time to blend the word "previver" with "survivor," "thriver," and "warrior" is now. Survivors may have not heard the actual words "you have cancer," but the threat of cancer alone has caused many of us to lose more than we can ever explain. Please join me in inviting survivors to the discussion so we can all have a part in defeating the awful disease we all know is cancer. If you'd like to connect with me, here are places where you can find me. My blog is www.rivergirlreflections.com. On Facebook, you can find me at Rivergirl Reflections. On Instagram, also Rivergirl Reflections. My email is rivergirlreflections@gmail.com. And if you are interested in receiving a copy of the BRCA Companion Book, the title of that is BRCA 19. You can find that on Amazon, or you can get a signed copy directly from me. Thank you so much for taking the time to watch this video. If it has helped you in any way, please let myself or Cancer Grace know. Thank you for your time.